Hello everyone! Today we will talk to you about the Kuznetsov Applicator and how to use it correctly, and we will look at the unseen ways of using the needle massager. Let's go! The needle applicator was invented in the Union of Soviet Socialist Republics by Ivan Ivanovich Kuznetsov in the 80s for self-healing after studying the basics of Chinese medicine. Originally it looked like a piece of foam with rows of sewing needles. From the 80s to the present day, about 70 million applicators have been sold across the country. Now it is used all over the world, and it's quite an effective tool that can help you cope with both pains in the musculoskeletal system and problems with internal organs. We all know the applicator from childhood, and it is practically in every Soviet family. But some people wonder if there are rules for using this massager. First, it's the sanitary treatment of the applicator. Before the first use, be sure to wash it with soap or wipe it with alcohol. And definitely treat it if it hasn't been used for a long time or has changed users. Second, this prepares for the procedure. It is recommended to use it on clean skin for 15 to 20 minutes before eating or 1.5 to 2 hours after eating. It is also necessary to visit the restroom because the use of the applicator stimulates the gastrointestinal and urinary systems. It's important to understand whether you're using the applicator for stimulating or relaxing purposes. A longer needle shape and shorter action time are usually used for stimulating techniques, while shorter and blunter needles with a longer action time are used for relaxing the tissues. If you're using the applicator for stimulation, use it in the first half of the day. If for relaxation, then in the second half of the day or before sleep. Also, after the massage, it's necessary to rest for 15 to 20 minutes and not immediately move on to active actions. Another key factor is using applicators made from medical grade plastic. Most often you can find such devices for sale in pharmacy chains. Previously, applicators were sold as a set of separate elements that had to be sewn onto fabric, and they were all of the same shape in the form of a triangular spike. In modern applicators, pre-made elements are used, which are most often equipped with a double needle. This is necessary so that the spike penetrates less deeply into the skin and injures it less, and it also gave a greater reflexogenic effect. Also, now there are different form factors to ensure good adherence to different parts of the body. Round rollers for use in the cervical spine area, cushions for good adherence in the lumbar and chest spine area, as well as large mats that ensure contact with the large body surface. Compact applicators are also often used to work with feet or to conveniently take with you on a trip. Also, before use, you should consider contraindications to the use of needle massage. This includes the accumulation of moles and birthmarks in the areas of massager use, dermatological diseases, wounds, abrasions and burns, sensitive skin, predisposition to bleeding, poor blood clotting, heart pathologies, the presence of tumors, epilepsy, exacerbation of chronic diseases, pregnancy or menstruation period. Let's look at the main methods of using a needle applicator for different types of pain. Needle massage is best for muscle pain. If you have pain from a hernia nerves or severe osteochondrosis, it can be part of complex therapy. A large mat is used to relax the entire spine. Everyone has a different tolerance for the prickly applicator, so if you initially find it difficult, you can use a light shirt. Next, once you get used to it, or if the level of impact is acceptable for you, it would be good to use it on bare skin. Lie down on the applicator with your whole back and straighten your legs. With straight legs, the pressure level is minimal and you can get used to it well. Initially, there may be some tension in the muscles. This is a normal reaction, like a pain response. Next, if you don't fidget and calm your breathing, the muscles will start to relax and the temperature in the spine area will increase. This is usually a pleasant, relaxing feeling. To enhance the effect, you can bend your legs, then the pressure in the lumbar area will increase. If you want to create even more pressure in the spine area, you can lift your legs higher and pull them a little towards you. In this way, you can maximize the pressure in the lumbar area. To unload the load, you can, on the contrary, lower your legs and slightly increase the pressure in your feet. In this way, We will unload the load in the lumbar area and increase the load in the chest area of the spine. Once you get fully used to the prickly effect, about 2 to 3 minutes in, slightly lift the right and then the left side to slightly shift the needle effect. If that's not enough, you can crawl a little bit higher or lower with small movements. Next, wait again for 1.5 to 2 minutes to get used to it, and you can slightly change your position again. When you change your position, it's better to completely detach your body from the needle applicator, not trying to move by sliding, in order not to scratch your skin. For more precise work with the lumbar or chest section of the spine, you can use a bulging pillow. Place the pillow in the lumbar area, in the lordosis area, and lie on your back. For progression, intensity, and action, you can use different leg positions. The first leg position is extended, the second leg position is bent, but we don't put weight on the feet. The third leg position is pulled up to the stomach. You hold them with your hands. For maximum load, you can pull your legs up to your stomach, which will maximize the effect of the exercise. If you have unpleasant sensations in the intervertebral area along the spine, you can also use this type of roller. Place it vertically and lie directly on the roller with the affected area. This can create maximum contact between the affected area and the spiked applicator. The overall duration of the procedure for relaxing the lumbar and chest area is 10 to 15 minutes. Also, the massaging effect of the needles on the entire spine provides a good relaxation sensation and sleepiness. Therefore, it is very good to use an applicator with short needles for 10 to 15 minutes before sleep to improve sleep quality. For more localized action in the neck area, for example, with high blood pressure or headaches, you can use a roller. For this, place the roller in the nape area with a slight transition to the cervical spine. Then lie down in such a way that your head is not too tilted back or too bent down. Stay in this position for about 2 to 3 minutes. Once you get used to the massage effect, you can slightly lower your head, thereby stretching the suboccipital muscles and changing the position of the roller. After 2 to 3 minutes of getting used to it, you can return your head to a neutral position, avoiding the position of a tilted head. The overall duration of the effect for relieving a headache is approximately 10 to 15 minutes. Usually only one procedure per day is required to relieve the onset of a headache. If the headache has not completely gone away or has returned, the course can be repeated. I often use the Kuznetsov Applicator to improve sleep, and I think it's a very effective method. By the way, if you use the same applicator often enough, after about 6 to 9 months the needles become less sharp and it's desirable to change the applicator. In the next video we will definitely show the stimulating effect of the applicator, as well as how it can be used to affect various internal organ diseases. Special thanks to the Kuznetsov laboratory for providing the equipment for the filming of this video. Good health to everyone.